respected chairperson, distinguished delegates. I think everyone is waiting for to hear from Professor Moni Abraham. So I have to go fast, and also by this time I have removed some slide from my presentation to make it short. My presentation is post-surgical exercise regime to prevent mandibular deviation in partially resected mandible or oral squamous cell carcinoma patient. Surgical management of oral squamous cell carcinoma frequently requires partial mandibulectomy due to loss of structures related to the jaw movement. Most patients experience speech difficulty, deglutition difficulty, and difficulty in mouth opening. The role of post-operative physiotherapy is important to improve function and aesthetic requirement of the patient. Here you can see what are the defects created during cancer surgery. Marginal, on marginal defect, segmental defect, subtotal defect, and total defect. If we see the Cantor and Curtis classification, class 1 defect is related with a part of mandible excision and which has lower border continuity, and this is called continuity defect. And class 2 excision, segmental defect, which is from and segmental free and dissection, which does not cross the midline, and it may be unilateral or bilateral. And class 3 excision, segmental free and dissection up to the midline, or it may cross the midline. And class 4 excision, it is the class 3 excision together with removal of temporomandibular joint, TM joint. And class 5 excision, anterior boundary dissection is class 5. So what are the changes we can see if there is any surgical excision due to cancer surgery? There are many physiological changes in the mouth, oral cavity, deglutition, speech, mandibular movement and mastication, saliva control, and respiration. Here is the data of 111 patients studied in our Suhrawardy Medical College Hospital, oral and maxillary surgery department. There were different variables, and we used jaw deviation. Here I put jaw deviation only from the complication variables. And here you can see mild deviation in 21.6% patient, moderate deviation in 47.7% patient, and no deviation in 17.21% patient. This patient was operated with partial mandibulectomy, and as the skin was removed, some skin was advanced from the cervical region, and there was huge deviation of mandible. And this patient also same, deviation of mandible is remarkable. You can see mandibulectomy, partial mandibulectomy, and also with maxillectomy, and the deviation is remarkable. Reconstructed with, after surgery, reconstructed with PMMC flap, and also deviation of mandible and mouth opening also restricted in this patient. Here also same, deviation is remarkable in case of partial mandibulectomy left side. As though adaptation is good, tissue adaptation is good, and also reconstruction is good, but deviation of mandible is remarkable in this, noticeable in this patient. Now for control of deviation, what do we use? For control of deviation, usually prosthetic devices are used, and also bite planes, and sometimes elastic extraction are used with the arch bar and also IMF screw, and physiotherapy we can use. And in case of cancer patient, all patient cannot tolerate the bite plane, and also arch bar or elastic action cannot be tolerated by the patient. So physiotherapy is important, can play an important role in management of deviation. We used 36 cases who were instructed to use physiotherapy after post-surgical management, during post-surgical management. Post-operatively, they are using physiotherapy, they are doing physiotherapy, and we instructed all patients to how to give exercise, how to use the procedure, and all patients, 36 patients had no deviation of mandible. Only some problem of mandible problem was there in mouth opening. There was below 30 millimeter mouth opening was 6 patients. Speech difficulty was slurring speech in 28 patients, and deglutation problem was in 2 patients. But all patients was without any deviation of mandible. This patient was treated with partial mandibulectomy and maxillectomy, and good result we obtained after proper physiotherapy. And the physiotherapy was started 1 week after the surgery by the patient. This patient also same, and though the patient came after 3 years, and after 3 years the occlusion and everything, the patient's speech, deglutation and mouth opening, everything was all right, satisfactory. Though the mouth opening, there are some deviation of mandible, but during occlusion, the grinding, the patient's grinding was very good, and occlusion was in very good position. We can give instruction to the patient for doing physiotherapy like this. Only with one finger, the patient can push the mandible from the resected side to the normal side, and they will give, they will bite, and during opening and closing the mouth, they will only give pressure and keep in occlusion, and it will take, they will occlude the teeth for about 10 to 15 minutes daily for 2 to 4 to 5 times daily. If they can do this practice, there will be no deviation of mandible. We have seen in 36 patients. This is also a case of good occlusion after partial mandibulectomy. We can see the video.
আপনি হা করতে অথবা মুখ বন্ধ করতে কোনো সমস্যা হয়? একটু হা করেন তো দেখি, মুখ বন্ধ করেন। আপনি কি যে রেগুলার প্র্যাকটিস ইয়ে করেছেন, ব্যায়াম করেছেন মুখের? জি। কিভাবে করেছেন ব্যায়ামটা একটু দেখান তো, প্রথমে হা করে দেখি সবসময় করতেন?
জি। Just giving pressure to the mandible from the
কামড় দেন
at the excised area.
কামড় দেন।
Bite is normal.
আচ্ছা, আপনি
অপারেশনের পর তো আপনার মুখ বাঁকা হয়নি, কোন ধরনের ব্যায়াম করেছিলেন? কি রকম? কামড় দিয়ে ধরে রাখতেন? আচ্ছা, হ্যাঁ, হাতটা নামান।
হা করেন কতটুকু? এতটুকুই হা করতে পারেন? ঠিক আছে। আচ্ছা, আবার কামড় দেন। আপনার অপারেশনের পরে কি এত সুন্দর কামড় দিতে পারতেন?
In follow up, and you can
তাহলে
see
এত সুন্দর কামড় দেয়া কিভাবে শিখলেন?
bite is normal and the patient can eat from the left side.
এরকম করে আমি এখন কামড় স্বাভাবিক হয়, সমস্যা হয় না।
আচ্ছা, আচ্ছা, আপনি খেতে পারেন এখন?
জি খেতে পারি।
আচ্ছা, পেছনের দাঁতে দাঁতে কি কামড় পড়ে ঠিক মতো?
হ্যাঁ পরে সব
আচ্ছা,
জানি।
দেখি। আচ্ছা, হা করেন। হ্যাঁ, কামড় দেন। আচ্ছা,
So for the after surgery, for every patient, you can postoperatively we can instruct the patient to follow these rules, and if they can follow, they can push the mandible by themselves. There will be no need to take help from the others, and this will be the way to prevent deviation of mandible, and we can give the patient a good solution of mandibular deviation. Thank you very much. Thank you very much.
Thank you, Professor Dr. Nasir Uddin sir, for your nice and excellent deliberation in preventing mandibular deviation following partially resected mandible of oral squamous cell carcinoma patient, which will improve the quality of life. So it is very much helpful for the patient. Now I would like to request our next speaker,